In Queensland, a mental illness is legally defined as a condition characterised by a clinically significant disturbance of thought, mood, perception or memory, and according to this definition by the Mental Health Act 2016, Odessa does not fit these criteria for mental illness. This act states that a person cannot be deemed to be suffering from a mental illness solely on the basis of having or not having particular beliefs related to their culture, religion, philosophical or political affiliation, belonging to a particular racial group, their economic or social status, having a particular sexual orientation or preference, or engaging in sexual promiscuity, conducting themselves in immoral or indecent ways, or partaking in illegal activities, consuming drugs or alcohol, being antisocial, having been involved in family conflict, having an intellectual disability, or having had a treatment for a mental illness in the past, either voluntarily or involuntarily. In order to ascertain whether Odessa is presenting with a true disturbance of thought, mood, perception, or memory, she would need to be assessed by a health professional adept in the field of mental health, and this diagnosis would need to be made in accordance with internationally accepted medical standards. The notes from Odessa's case do not provide enough information to properly discern her mental status at both the time of the incident and the time of refusal of transport. Therefore, we must assume that she is of sound mind and is not suffering from any clinically significant disturbance of thought, mood, perception, or memory. The main objective of the Mental Health Act is to maintain and improve the well-being of people who have a mental illness who do not have the capacity to consent to treatment. This Act allows a health practitioner to deem one incapable of making an appropriate informed choice at that time should their mental capacity be altered. A person is considered to have mental capacity if they are capable of understanding the information being provided to them, weighing up that information in order to make a decision, being able to retain information for long enough to make a decision, and communicating that decision appropriately to others. If a person is unable to complete the above, they may be considered incapable of determining the course of their healthcare, where an emergency examination assessment may be placed in order to get them the treatment required. As Odessa is not yet 18, in most cases she is not legally considered to be an adult. However, children under the age of 18 are allowed to make their own medical decisions where they have a sufficient understanding of their condition and treatment. In order to assess whether or not a young person is able to make a decision, the Gillick test is used to determine the person's maturity, education, and emotional and physical condition. The assessment also includes considering the child's age, attitude, and maturity, their social circumstances, the nature of their condition, the reason they don't want to inform their parents, the risks associated with the illness, the consequences if the child does not receive healthcare, including permanent disability and death, and that the young person is able to understand the permanence of death and disability. Odessa has demonstrated a maturity and attitude advanced enough to consider her to have the capacity to make informed decisions about her own healthcare and is therefore considered competent under Gillick's test. A person's mental capacity may fluctuate in a transient state. Capacity can be greatly influenced by various mental states, including intoxication, panic, shock, fatigue, and, in Odessa's case, hypoglycemia. These states are not permanent, and a person's mental capacity will improve when not influenced by other factors. A person may better understand information at different times of day or in particular contexts, and therefore have a greater mental capacity. A healthcare provider should not make a decision about one's capacity when it is at its lowest. Steps should be taken to rectify one's capacity and maximize a person's decision-making ability. Upon arrival at the scene, Ezra may have assessed Odessa as having impaired capacity due to her presenting state of hypoglycemia, when in fact he should have assessed her capacity upon her condition improving, following the administration of oral glucose, and therefore she was of sound mind to make an informed decision. Odessa has clearly communicated her decision to refuse transport to hospital and does have the capacity to make this decision on her own behalf. Capacity is defined as the ability of a person to understand the nature and purpose of the proposed treatment and the consequences of the decision to refuse. From the case notes, it is unclear to what extent Odessa understands the consequences of refusing treatment. However, she does understand her medical condition, so it can be assumed that she understands the potential for having a further hypoglycemic episode and therefore has capacity to refuse treatment. As she has refused transport, the only way for the attending paramedics to get her to hospital is under the order of an EEA. The Public Health Act states that in order for an EEA to be put in place, the attending officer must believe that a person is at immediate risk of serious harm, the risk appears to be the result of a major disturbance in the person's mental capacity, and that the person appears to require urgent treatment. The Queensland Ambulance Service states that EEAs do not apply in circumstances where a person of sound mind makes a voluntary decision to refuse medical treatment, even if that decision may result in the person suffering preventable harm. Therefore, Ezra does not have grounds to place Odessa under an EEA and is in direct violation of the law and the bioethical principle of autonomy if he does so. Deprivation of liberty may occur in the instance of an EEA being enforced, and thus can only be justified in the interests of patient and public safety. However, where mental capacity is not altered and the patient is able to make an informed choice, the patient has the right to refuse treatment and transport at that particular time. Odessa's decreased mental capacity during her hypoglycemic episode is not a fixed state, and following administration of oral glucose, her condition improved. The case does not state to what level her condition improved. However, if she was capable of making an informed decision about her care, Ezra's decision to use an EEA unjustifiably deprives Odessa of her liberty and freedom to choose, as she is not a serious danger to either herself or anyone else, as she does not intend to drive again, but to wait for the tow truck driver. Instead of placing her under an EEA, Ezra could leave the glucose with Odessa for her to administer should she begin to feel the symptoms of a hypoglycemic episode again, as she was able to recognize them in the first instance, but was in a hurry and did not take the time to eat. In addition, Ezra should encourage Odessa to eat some complex carbohydrates as soon as she is able. Instead of placing her under an EEA, Ezra should explore Odessa's reasoning for declining healthcare and consider the importance of her errand in comparison to her welfare. He should encourage her to inform her parents of her current situation, consider other options for Odessa, including seeing the GP, and documenting the details of the discussion, which is vital to ensure Odessa's refusal or acceptance of treatment is voluntary and free from any pressures from health professionals in order to be considered valid.